My grandmother was telling me that there used to be a clinic in Zone 1. It was not built by the ANC, it was built by Apartheid. Where she stays, there was a clinic built by Apartheid. And the ANC went to close the Apartheid clinic. That clinic is not functioning. The EFF in my ward marched day in and out to demand that that clinic must be opened. And then when we say to you, the apartheid was much better than these people, you think, no, these people are exaggerating. We speak into the practical things that we see. Here is a clinic under apartheid, functioning. Democracy comes, the clinic is collapsed, closed.
The very regime that was so hard fought to overthrow, the architects of oppression and injustice, actually built a clinic that served the community. And then, what happened? Democracy arrived. The ANC came into power, and one of their first acts, in their infinite wisdom, was to close that apartheid-era clinic. Close it. Not upgrade it, not integrate it, not even repurpose it. They shut it down. And to this day, it stands as a monument to their incompetence and ideological blindness, a derelict, non-functioning building. This isn't just an isolated incident, it's a symptom of a much deeper, more insidious problem that plagues the nation. The public is constantly fed this narrative that apartheid was an unadulterated evil, a system of pure oppression. And yes, it was. But when practical, tangible examples are pointed out where the apartheid government delivered basic services, like a functioning clinic, while the democratic government has failed to maintain them, or even actively dismantled them, critics are accused of exaggeration. They are told they are romanticizing the past. But they are not. They are speaking to the practical things that they see. Here was a clinic, under apartheid, functioning. Democracy comes, and the clinic is collapsed, closed. This is where the outrage boils over. This is where the hypocrisy becomes so blindingly obvious it makes one want to tear their hair out. The economic freedom fighters, EFF, in their ward, are day in and day out demanding that that clinic must be opened. They are fighting for the most basic of services for their people, services that were once provided by a regime they revile. And while they are demanding the opening of closed clinics, what is the state of the existing healthcare system? It is in tatters. Hospitals are overwhelmed, underfunded, and crumbling. One needs only to walk into any public hospital in this country to witness a crisis unfolding before their eyes. Beds are scarce, equipment is outdated or non-existent, and the queues are endless. People are dying in hospital corridors, not from their illnesses, but from neglect and a complete breakdown of the system. The most egregious failure, perhaps, is the catastrophic shortage of staff members. Nurses are overworked and underpaid, demoralized by the sheer volume of patients and the lack of resources. Doctors are leaving the public sector in droves, seeking better conditions and compensation elsewhere. There is a brain drain in the healthcare system, with the most skilled medical professionals being driven away by the very government that should be cherishing them. And then, the ultimate irony, there are masses of unemployed doctors. Highly trained medical professionals, fresh out of university, ready to serve their communities, are sitting at home, unemployed. How can a country with a collapsing healthcare system, with desperate shortages of medical personnel, have unemployed doctors? It defies all logic, all reason. It is a monumental failure of planning, of foresight, of basic governance. This isn't just about a lack of jobs, it's about a fundamental misallocation of resources and a complete disregard for the well-being of citizens. It's about a government that would rather grandstand and cling to ideological purity than solve the practical problems facing its people. This brings to light the profound irony of the EFF's position, of the stance they are taking. For those who know their history, their rhetoric, their unwavering commitment to dismantling the remnants of apartheid and fighting for radical economic transformation, this might seem contradictory. Julius Malema, a vociferous critic of everything apartheid stood for, is here lamenting the closure of an apartheid-era clinic and highlighting its superior functionality compared to what currently exists. This is not an endorsement of apartheid. Let it be unequivocally clear, apartheid was a crime against humanity. But it speaks volumes about the current state of affairs when even they are forced to acknowledge that in some instances, the previous regime, for all its evils, provided better basic services. This is not about celebrating the past, it is about condemning the abject failure of the present. The ANC, the party that promised a better life for all, has overseen the decay and collapse of essential services. They have prioritized patronage over performance, rhetoric over reality. They have allowed ideological purity to blind them to the suffering of their own people. The closure of that clinic in Zone 1 is not just a localized issue, it is a microcosm of the larger failure of the democratic project in South Africa, particularly when it comes to healthcare. The public is told to forget the past, to look forward. But how can they look forward when the failures of the present are so glaring, so debilitating? How can they move on when basic services that existed under a repressive regime are now denied under a democratic one? This is not about nostalgia, it is about practical solutions. It is about demanding accountability. It is about recognizing that the government, regardless of its liberation credentials, is ultimately judged by its ability to deliver for its people. And on the crucial front of healthcare, the ANC government has failed, miserably.